Thanks, Tim, and just want to extend my welcome to you all as well. It's been pretty much a year in the making, I think, looking at how it's been helping as well. So it's really exciting to be here and amongst like-minded colleagues around postgraduate veterinary education. Just wanted to start by really shining a light on the postgraduate setting. I think this started when we were looking for some evidence in the literature around some postgraduate matters for some of the projects that we've been running at the RCVS. In particular, we're looking at the veterinary clinical career pathways and trying to develop new pathways. And what really struck me is that in veterinary medical education, it became apparent really quickly that the vast majority of publications out there are relevant to the undergraduate phase, and actually relatively few focus specifically on postgraduate veterinary education. However, if you look at someone's typical career, and my slides haven't moved forward there, they have here. If a typical career is around 40 years, say, actually about 12% of that is the first 5 years. And they are arguably the most intense, they're full-time education and vitally important. But postgraduate education touches everybody for the rest of your career. So whether that is new graduate transition, or if you choose to take on extra study, whether that's a postgraduate certificate or formal training in the form of internships or residencies, or CPD, remaining current for the rest of your career, it touches everybody, and for that reason, I think it's vitally important. Okay. There we go. Lucky Ella. So that postgraduate education comes in many forms. Again, some more formal than others. It can be just coaching that is often badged as informal, but is vitally important, as Tim's mentioned. It could be residencies, mentorship, or formal postgraduate qualifications, as I've said. So the aim of today is to really shine a light specifically on this aspect to make sure that it receives the attention that it deserves. And I think it's a real missed opportunity. It's not to say that excellent research and scholarship isn't taking place in the postgraduate area, but it isn't being shared as much as it could be so that people from around the world can learn from each other. So the aims of today are to learn about the current approaches and best practice across the continuum of postgraduate veterinary education. And as Tim's mentioned, we have an amazing group of speakers here over the next few days with huge amounts of experience. So it's to give you all the opportunity to meet them, to discuss with them in the breaks, and to discuss new ideas and innovations as well. Most of all, what I would really like is for this event to be not a one-off that happens once, but a platform for future events, to create a network, a community of practice internationally whereby people that are involved with postgraduate veterinary education can share ideas, can develop new ideas, etc. And with that, we'll probably keep coming back to what that might look like, because as at the inaugural event, all of you here today are hopefully engaged and want to help us take that forward. And on that, I want to move on to some other matters. So we have a number of sponsors here today. Moving from left, we have the Academy of Medical Educators, which is an international organisation specifically for educationalists. So please do go and see Tony at the stand, and he'll explain what our standards for educators are, how you can apply for membership and fellowship of the Academy as well. We also have IFEVET, and I think their table is in where the catering is, and that they run various postgraduate qualifications. And in addition to that, we have the RCVS Cert AVP stand, which is another postgraduate qualification, and these 4 universities are all represented there who deliver those Cert AVPs as well. So on that, we just have a little bit of housekeeping, I'm afraid. So there's no planned fire test for today, so if you do hear an alarm, please leave from the nearest exit signs, and we'll head to the muster point outside. The catering you might have already noticed. We did have breakfast. There's a buffet lunch each day, and that will all be in the same room as it was before. This will include a vegetarian option, and if you have put any dietaries on your request, that will be catered for, so please find somebody if it's not obvious to you where that is. And if you do have any other queries, members of the events team are here all day. Please do speak to one of those. In terms of the rooms, we have 2 conference rooms. So we have this room, which is the banqueting hall, and we have the courtroom, which is on the ground floor. If you go along the corridor, it's the last one on the left. So when we split into parallel sessions, they're the 2 rooms. We will keep to time on the parallel session, so speakers beware. We will be very strict on the time. That does mean that you can move to and from the sessions. However, if that's your intention, please do look at the programme. If that's your intention, please maybe sit towards the back, and please try and do that quietly to respect the speakers, especially because where there's wooden floors, it can get quite noisy with people moving in and out as well. So the lunch breaks and coffee. I think that's working. The filming and photography. So the sessions in here will all be filmed, and we have a crew up there, and the aim is for that to be placed on the same page where you booked this conference, which is part of the RCVS website for now. We hope when this gets its new home, there will be a new home eventually, but everything will be placed on there. We also have a reporter that will attend various sessions to write up some proceedings in writing as well. That will also be shared. Some of you may be interviewed by the film crew as well, just again to ask why you came here, what you've enjoyed it, and so on. And with that, I think that's all the housekeeping. So it is my great pleasure to introduce our first session and our first speaker, which is Professor John Norsini, who is from Upstate Medical University, New York. So you all have a pack and you can see his biography, but John won't appreciate me doing this, but I just want to add a personal note. He won't appreciate me doing this, he'll tell me off later. But on a personal note, as a very young baby educationalist, one of the first people I wrote to learn about workplace-based assessment was John, who was in Philadelphia at the time. And he very generously invited me back and I literally camped in his office for a week and probably learned more than I have in anything else. So his generosity shows no bounds. So John has held at that time he was working at the American Board for Internal Medicine. Since then, he's had senior roles at the Foundation for the Advancement of International Medical Education and Research, FAMA. He's authored over 200 publications, has lectured and taught in more than 45 countries, and is still doing the rounds, shall we say, John? He's on the editorial board of several peer-reviewed journals and many, many more things. So it's my